Hi, and welcome to another podcast made by Uks Research itself. My name is Usman, and today we'll be discussing the impact of the ongoing COVID-19 pandemic on women living within Pakistan. Confirmed by the government of Pakistan, the first case of COVID-19 tested positive on the 26th of February earlier this year. However, over the course of a few months, with the ongoing lockdowns and social restrictions, many argue that the media has almost been too silent on the level of impact that this pandemic has had on the many lives of women living within this country. In April, the United Nations said that women's economic and productive lives would be affected disproportionately and different than men. From a worldwide increase in domestic abuse to cosmic challenges faced by working women, we will today address these various issues with Tasneem Ahmar, who's the director at Uks Research Center and the executive producer of Uks Radio in Islamabad and Karachi. Mr. Tasneem, it's always a pleasure to have you here with us.
Thank you, Usman. It's lovely to be back for another podcast.
Mr. Tasneem, getting straight into the questions, is COVID-19 gender neutral or is it prone to gender bias as well? And in what ways is COVID-19 specifically affecting the lives of Pakistani women?
Pandemics, disasters, whether natural or man-made, they always have different implications, or they affect men and women very differently. So, when COVID-19 pandemic emerged as a crisis, so it is gendered, of course, and while that in itself might be a new phenomena for some countries or in some countries, it actually spells trouble for a country such as Pakistan, where there are very obvious gender inequalities that exist in our society. So what happens is that women carry a threefold burden, as they are not only responsible for disease prevention or disaster prevention response efforts, whether it's rehabilitation, whether it is going on with all the safety measures, whatever the disaster or the pandemic requires at that time. And also, they are also at greater risk of infection. And then, above all, they are, subject to emotional, physical, and socioeconomic harm. So, like for every kind of pandemic, epidemic, disaster, it always has a double, triple impact on women. And this pandemic of COVID-19 virus is actually not very different from others. In fact, it's much more. So yes, it has a gendered side to it.
All right. Mr. Sneem, speaking on a more of a statistical level, we know that globally 1 in 5 women with partners have experienced domestic violence in the last 12 months or so, and that on average 137 women are killed every day by a member of their own family. These are all issues which resonate strongly in our own highly patriarchal society. So, with the rise in domestic violence, what options do women have to seek external help?
Uh, GBV or gender-based violence is a global phenomenon. Like for example, globally we can say that 1 in every 3 women experience either physical or sexual violence at some point in their lives, and in most of the cases, women, they know the perpetrator. So, keeping that scenario in mind, think of COVID-19 crisis that we are facing these days, and we see a horrible, horrific kind of surge in a global scenario of domestic violence, or we see a global surge in domestic violence. And the surge, ironically, the surge is linked to the safety side of the pandemic, because lockdowns are supposed to keep us, uh, women and men and children, everybody safe within the four walls of our homes, and that is actually that safety becomes a danger zone for women in current situation in COVID-19 crisis, as they are forced to live with the abuser, be it their father or brother or husband, or anybody they know, the sons even at one point, or anybody in the family who has been abusing them, and they could find some relief by going out at times. Now they are locked inside, and those men are locked inside. So they also have the full freedom of sort of exercising their rights, which again, quote unquote, it's not a right given by the society or constitution or religion, but they feel that it's the right to beat women. And that is how we find it so sad also that the safety of the house is not a safe haven for women. Like they cannot call it a safe place for them, because that is where the abusers are, and they can't go anywhere. So that in itself is sort of I would say it is quite a huge it is like it is a sort of a multiplier. It plays like a multiplier effect, where you have COVID-19 crisis, and then you have all these abuses. And that's, it's not just the abuser would be like carrying out acts of sexual abuse. It could be physical, psychological, or even economic, or just denying you your basic rights of breathing, for that matter, like breathing freely, not being sort of scared of people around you. So and then I think it has also showed us why we should look very, very deeply inside our own social structure, the socio-cultural structure, socio-cultural economic structure, if we may call it, and see that what is it that makes women so vulnerable, and why can't we, take up such measures that stops this kind of, violence against women, or GBV. And I think it's high time that we actually address these issues, because COVID-19 crisis has proved that women are being abused, and such cases are coming out. So that is one thing that is confirmed. It's not that one speaks just like that, but it is a confirmed phenomena that there is a surge in global scenario. There is a surge domestically, although domestically like for example in Pakistan, we haven't really had big studies being carried out, but there are organizations that are working towards that. So maybe they have a small sample of women who have been abused, but such studies will be coming out, and some of the work is also now available on internet.
Sure. We know that due to global lockdowns, working from home has become the new norm. In your view, how has this pandemic affected the lives of working women?
Um, again, like what we sort of knew before the pandemic arrived, it was that family structures are, fast changing, as more women are now the primary breadwinners in the lower rungs of society. And that is also due to the fact that labor is very cheap. The labor market, in fact, relies more on the cheapest labor available, which in Pakistan, or South Asian context, in many other Asian countries or other countries, it translates to more women and more children in the labor force. So what we also know is that there is more unemployment among men. This is profound implication for women in the household, as there are more battled, as there are more battered women in households living with abusive husbands. That this question actually is linked to your earlier one about the domestic violence thing, the violence against women, or GBV, because they're both sort of interlinked. And I'll just explain why is it, why does women's work get linked up with abuse, women being abused. So what actually has happened is that there are more battered women in households living with abusive husbands, unable to sort of like either find work, or incapable of dealing with the fact that they have no work. So that is a very crucial issue. A lot of women, in small industries, as daily wage earners, they are totally out of work, and the husbands were either not earning before, or even they are out of work. So there are families which are without any kind of support, and obviously that links up to abuse of women and children, because they are the most vulnerable part in the family. So and otherwise also, because a lot of men in these lower strata of society have not been working. Either they're drug addicts, or they just they just love to stay at home for one reason or the other. They are lethargic at a lot of times. They think that, okay, women are going to work, so there's no need for them to work. And there are 101 such cases where women go out to work, and even children go out to work, and the father, or the man of the house, as he's called, is comfortably staying at home. So, this isn't a case of mismanaged expectation, where women are actually expected to not only earn, they are expected to look after their homes, they are expected to look after their kids, they are expected to look after the houses, homes, they are expected to take care of the husband. So it's a case of not mismanaged expectations. It's a case of inhumane expectations, I would say. It's actually is very inhuman, because you don't think that a woman has any kind of human rights.
All right. How much of a toll do you think has this pandemic taken on women's health?
I would say that 75%, as the studies show us, of the global healthcare workforce are women. And women are also largely the main caregivers in their own homes, as I just had said earlier, and the most likely to be responsible for nursing children and elders who are ill, home from school or in isolation. So, as women are responsible for the majority of caretaking, both in private and at work, it, I think, increases the likelihood that they will be exposed to the virus, more than anybody else. And this again is also linked to their sexual and reproductive health and rights, which is it is a significant public health issue, and it actually requires a lot of attention during pandemics, and COVID-19 is, of course, no exception. So what we need to look at is, are women being able to have safe pregnancies and childbirth? What kind of medical and health facilities do they have? What kind of safety measures do they have intact? Is there, are they, everybody's following the preventive measures? What kind of a household there is? How much support the woman has? And also, the provision of family planning and other sexual and reproductive health commodities, including menstrual health items. These are all very central to women's health. Not only central to women's health, but it's also very crucial for empowerment and sustainable development, and may be sort of impacted as supply chains undergo strains from pandemic response. And in our scenario, the worst to be hit by poverty is again women and young girls, because as a tradition, women would eat last. As a tradition, women would spend money on themselves last. So a lot of their very genuine health needs, like I said, menstruation, supplies, they'll go for unhygienic means, rags, old cloth, rather than buy a pack of sanitary napkins. So pandemics play havoc with everybody, but they play havoc a lot more with women and young girls. So we actually have to keep in mind, all these things, and all these until we sort of address these obstacles and barriers, we can't enable women and girls, to access to their access to service. And it also includes, in the psychosocial support services, especially, those subject to violence or who may be at risk of violence in quarantine. You see, everything is linked. It's sort of a chain effect. Domestic violence or violence against women, or GBV for that matter, is linked with the work that women do, whether they're inside the house or outside the house, and then also what kind of implications does it have on their health, on their mental and physical and sexual and reproductive health. So all that is very interlinked, and until unless we see each issue as a big issue in itself, and then again link it up with the other, we can't find solutions. So we actually really have to be very, very, I think now it's the time that we as a nation, we as advocacy people must start to redefine women's rights in our society, because in our scenario now, the COVID-19 crisis, a lot of inequalities have surfaced, and we need to look at them very seriously. So yeah, so we need to make sure that there is provision of accurate and supportive care, and messaging must be done with the intention to enhance people's safety, dignity, and rights, and women's rights come right on top.
Absolutely. Do you think there's going to be a lasting impact on the education of young girls in Pakistan? And what can we do as a society to ensure that we do not lose the ground that we've already gained?
Education as it is you know not a huge priority for us. um, we have been sort of just struggling to do better in provision of educational facilities, especially to our to the people from our poorer areas, who who actually send their children. The whole concept of child labor is so acutely connected with poverty, that until unless you take care of poverty, you can't get rid of child labor. And until unless you get rid of child labor, you can't make sure that every child goes to school. And again, here, while we talk about both a male and female child, a female child is more likely be to suffer more during pandemics, and also because there is the kind of environment that we have. For example, now a lot of schools and educational institutions have started online classes, virtual studies. So boys may have a better chance of sitting in a group and doing it. uh, Girls will have a hard time convincing their parents that a lot of them are getting together, or not lot obviously because of COVID, but at least 3 or 4 students could be together to uh, line up and try to get the online education. So I would say that a lot needs to be done to make sure that these female students are not, they don't drop out, because as it is, we have a huge dropout rate or ratio for female students when they go to higher schools. There's a huge dropout. There are few very obvious reasons for that. One is safety. Schools are at a distance from their homes, and parents don't feel very safe sending them on their own. A lot of them can't afford transport, so the girls have to go on foot. That is one. The other is that a lot of schools don't have proper toilet facilities. So at an age when the girl starts to menstruate, they can't find the facilities, so they drop out. So all these, and then a lot of time, the child marriages and all those things are also an important part of it. So we need to make sure that girls from the poorest households who are sort of unable to access continued learning through online devices, um, how do they purchase materials for learning at home? Is there any mechanism that's been put together for these girls to be able to get some kind of a stipend to be, because I know for sure that a lot of these charity schools also don't provide with everything. So a lot of these girls don't even have a cell phone to get their lessons, on the cell phones. So all these things have to, and of course, it will it will be a boy who can get a cell phone earlier than a girl, because again there is a social pressure on parents not to give their girls, their daughters, a cell phone, because that is I would say that leads towards a new world, and a lot of parents don't want their girls to explore the new world. They feel that they may get hooked up by somebody, or they may run away from home. So all those things are there. And COVID 19, again, the whole crisis, I think it is impacting a lot on girls' education. And our educationists, our education ministry, actually needs to take a deeper look at it.
You've mentioned the various issues faced by women during this pandemic. How is Uks specifically contributing to helping women during this ongoing COVID-19 crisis?
Uh, as you know, Osman, that ours is a research-based media organization. So we have been monitoring the media in Pakistan for its coverage on COVID-19 through gender lens. And at the moment, we are giving final shape to our comprehensive research report, which is based on monitoring and analysis of our media from March till June 2020. So, and this is a huge undertaking. I mean, the kind of data that's come out, the kind of I would say the kind of gaps that we found in the content, everything is there. So it is, monitoring the print media, the electronic media, television, and newspapers, both. So we are giving final shape to that, and as I said, it's a huge undertaking, and that also without any funding. Initially, I did try, and I tried to reach out to people, um, organizations like INGOs, and even I would say the corporate sector for CSR thing in their uh, I would say companies, but it was, we didn't have any success. So I decided, and I was very, very keen. I was, in fact, I was very, very uh, passionate about this work, that it must come out. This was the first of its kind study again in Pakistan. I don't think there has been any study anyway, because I keep looking out for data. So I decided to fund it myself through my personal funds, because obviously we have to pay the monitors, we have to pay the person who is compiling the report, we have to pay the graphic designer. We're not getting it printed, obviously, because that is another kind of expense. So we will be sharing it online, and so that is one thing that we're doing, continuously monitoring the media on Pakistani media on its coverage of COVID-19 through a gender lens. The other thing that we've done is that we have started to produce radio programs. The radio programs and the public service messages on COVID 19 have been, I would say that they have actually been produced keeping in mind, you know, how to bring out women's stories, their perspective, their active roles in the COVID 19 crisis, their participation in public debate, along with that of minorities and other vulnerable groups. We have also been very conscious on inclusion, because we would we made sure that women and marginalized groups were not left out. They are not left out, and that they are not stereotyped or misrepresented or misrepresented. So, sharing of stories of local people who have experienced COVID-19 and, have recovered. So, to give the message to the people, to the listeners, that a lot of people do recover from COVID-19. So it's not a bleak scenario for COVID-19 positives. And since we have a very strong gender sensitivity policy, we are the first ones to have brought out a gender sensitive code of ethics for the entire media. So we are very, very keen on following the guidelines and also telling the media that, what are the guidelines to follow. So that is something, and the productions will be, we will continue with the productions. We will continue to bring out case studies, oral testimonies, good examples, suggestions, recommendations of, relevant and authentic sources, everything. Because, you know, uh, we have to actually give a lot of information to the vulnerable population. For example, what kind of services there are available for women who are uh, in a situation where they need help. Uh, so there are, organizations that are providing these kind of services. They are there are online help available. There is help on mental health. There is help on, battered women. So all the media needs to do is uh, bring out such information as much as possible, and that is what Ux is also trying to do in its, in our own little capacity.
Certainly. What steps can we further take as a society, which includes the government and the public at large, to improve the situation for women?
Um, COVID-19 crisis actually has brought out in the open a lot of issues that have been there in our society, in our in surroundings, and maybe a lot of us did not pay any attention to it. So now, the government, the public, the media, we all need to focus on what it is that needs to be addressed. What are the main issues? So I would bring gender equality on top. Uh, uh, and I think starting with that, we have to ensure that, public health messages are properly, aimed at women, including those who are most marginalized. Now, how do we get to the most marginalized population is for the communication experts in the government and private sector to find out, to explore, what are the ways. I would say radio is one of the best options. So, how do you reach out to the larger population? We also need to, develop sort of mitigation strategies that specifically target the economic impact of the outbreak on women, and and we need to sort of build women's resilience. By nature, women in Pakistan, as in a lot of other countries, they are resilient. Be it the 2005 earthquake or be it the floods of 2010, 11, women are very, very quick to start to rebuild, rehabilitate, because they are the ones who have to take care of the cooking, washing, everything. So they need their own four walls for that. And that is why they are resilient by nature. Very, very opposite to the portrayal that we see of women in disasters and epidemics. The one that is always sort of women weeping and crying or shown as helpless. There may be some, but the majority of women are very hardworking, very brave, I would say, and top resilient. Yeah, they are. So that is one thing, to build their resilience. I mean, to build it further, to build it further. Also protect essential health services for women and girls, including sexual and reproductive health services. as they are the most important in normal life, daily routine, and more so during a pandemic. I would also like to, I think, indicate the whole, I would say, the phenomenon of stigma, stigmatizing people. COVID-19 has also done that, and that is, has been that that's why a lot of people are still very reluctant to admit that they are COVID positive. A lot of them don't want to be hospitalized. A lot of them don't want to be tested for, because they say that if we get tested and if I turn out to be positive, we will be thrown out of this area. And a lot of uh, times, they don't want people to know about it. So the stigma has to go, and the same stigma used to be with the HIV positives in the beginning, and gradually people started to take them as human. Otherwise, learning of any HIV positive, they would just shriek out, sort of freak out, and try to throw them out of the community. So that is one thing. And I think we also need to do away with the stereotypical images, the language that discriminates, and also the kind of attitudes that some people demonstrate. So we have to be very careful on how we actually look at COVID-19, and what kind of I would say services one would like from the government and the private sector. And for that, I think the best way is to share as much narratives or stories that sort of humanize the experiences and struggles of individuals or groups who are affected by COVID-19. That way, the population comes to know that okay, this pandemic is there, but these are the ways to take care of it or come out of it. So yeah, that is what I would say on this.
Well, thank you very much, Mr. Sneem, for being here with us today. Your views and explanations have allowed our viewers and I to further gain clarity on women's issues during COVID-19. Of course, with the ongoing pandemic, the many injustices against women need to be further addressed by policymakers and the general public. The efforts and determination shown by you and your team at Uks give us all hope for a better tomorrow. Just before you leave, is there anything that you'd like to add in the end?
In the end, I would just like to, I think, re-emphasize the role of the media, and say that if the media is not conscious about inclusion, women and the marginalized groups, and if they are left out, stereotyped, and misrepresented, it will be a great disservice to the community and to the society. And we need gender sensitivity to be the top priority, and the media needs to sort of do away with reinforcing deeply rooted biases that can have sort of long lasting and devastating effects on how the society responds to crisis and ultimately to gender equality. So yes, and with that I would like to thank you for inviting me again, and it was great talking to you. Thank you so much, Usman.
The pleasure's all mine. Well, thank you very much, ladies and gentlemen, for tuning into this podcast by Uks Research. Please follow our Instagram and Facebook pages and don't forget to view our online website to stay in touch with our day to day activities. In the end, let's strive to play our part as individuals to make this world a safer place for women in these darkest of times and beyond. Bye bye and stay safe.